Hello, my name is Stephanie, and today I will be performing the inserting and discontinuing IV skills video. I'll start off by entering my patient's room. I will close the door behind me to ensure patient privacy. I will perform hand hygiene. Hi, Mrs. Jackson. My name is Stephanie, and I will be your nurse today. Can you please verify your first name, last name, and date of birth for me? Thank you so much. So I went ahead and verified my patient using two identifiers and checking the wristband. I have checked the provider's orders in the EMR and I verified I have the correct patient. So now I'm ready to begin the procedure. So today the doctor has ordered an IV insertion, which is needed to administer IV fluids because you're dehydrated, okay? I will collect and organize all of my supplies. I will place them in a clean and clutter-free surface. I will grab a IV start kit. I will select the appropriate size catheter for my patient's needs here, which in this case is a 20 gauge by 1 inch needle. I will grab a IV extension tubing. I will grab saline, a hand sanitizer, a sharps container. I will grab a pen, gloves, and tape to secure my tubing, and gauze later on during the procedure. I will also open and prepare the sterile packages here using a sterile aseptic technique. I will apply clean gloves. I will grab the IV extension set for my packaging. I will remove the ends of the tubing. I will make sure that the tubing is not clamped. I will attach a pre-filled saline syringe, and I will prime the extension tubing to remove air by releasing 1 to 2 drops of saline. Right. Once I've done that, I will clamp the tubing. I will grab a tourniquet and apply it around the patient's upper arm here, about 4 to 6 inches above the IV insertion site. I will make sure not to apply the tourniquet too tightly and check for a distal pulse. Now that I can feel the pulse, I will take an alcohol pad and I will cleanse the skin in a circular motion from the insertion site. So from the inside to an outward area here. I will let that dry for a few seconds. I will grab my needle from the packaging here, throw the packaging away. I will remove the needle cap. I will make sure that the bevel is pointing up. I will place my thumb here over the vein here, 1 to 2 inches distal to the IV insertion site, and that's opposite the IV insertion site. I will stretch the skin against the direction of the insertion site, and I will anchor the vein, and I will insert the needle with the bevel up at a 30 to 45 degree angle. I will observe for blood return in the catheter or a flashback in the chamber. So the blood will indicate that the bevel of the needle has entered the vein. Now I will advance the needle approximately 1/4 of an inch into the vein. And as I continue to hold the skin here, I am stabilizing the needle. And with my right index finger, I will push off the tab. I will advance the catheter into the vein until the tip of the hub touches the injection site. So now that the catheter has been advanced, I will pull out the needle. I will use my left index finger to hold the catheter in place here. And at this step, I'm actually supposed to retract the safety device by pressing the white button here, and the needle will retract. But since this is my last needle, I will not be doing that, just in case that I need to reuse the needle in the future. So I'll drop this into the sharps container, and I'm still securing the IV with my finger here. Now I will release the tourniquet. I will grab and connect the saline with the attached tubing to the IV. I will make sure the tubing is declamped. I want to secure the connection. So I just want to point out that I will avoid touching the sterile connection ends to avoid any contamination here. So the next step is to aspirate to assess blood return. And once I see a bit of blood return here, I will slowly inject the saline from the pre-filled syringe here. So once the saline is injected completely here, I will clamp the tubing. I will remove the empty syringe only and discard it into the sharps container. So I'll discard this into the sharps container. As I continue to secure the IV with my left finger, I will grab a Tegaderm, which is a sterile dressing. I will remove the backing. I will apply it over the injection site here. I will take a few seconds here to make sure that everything is intact. So when applying the Tegaderm, I really want to make sure not to touch the extension tubing just in case it needs to be replaced. I will remove the backing. I will loop the extension tubing here and secure it with a piece of tape. And I'm going to loop it directly over the tubing with the piece of tape. I will write the date on the dressing, the time of the IV insertion, the gauge size, the length, and my initials here. I will dispose of any remaining sharps in the appropriate sharps container. I will discard the used supplies. I'll go ahead and move on to the next step, Mrs. Jackson. Now I'm going to document the procedure in the computer. Do you need anything from me? All right, the call light is right next to you. Let me know if you need anything from me. So I'll remove the gloves. Go document my procedure. So to discontinue the IV, I'll enter my patient's room. I'll close the door behind me to ensure patient privacy. I will perform hand hygiene. Hi, Mrs. Jackson. My name is Stephanie, and I'm back to discontinue your IV. Can you please verify your first name, last name, and date of birth for me? So I went ahead and verified my patient using 2 identifiers, and I also checked the patient's wristband. I will perform hand hygiene, and I'll apply clean gloves. So I will take 2 gauze and a piece of tape. I will remove the tape that's securing the extension here. I will throw that away. So I will stabilize the IV and remove the Tegaderm dressing. I will place a sterile gauze above the insertion here, and I will slowly remove the catheter, making sure to keep the hub parallel to the skin. I will apply pressure to the site for a minimum of 30 seconds here, or until the bleeding has stopped. So I will inspect the catheter to make sure that it's intact. After removing it, I will check for integrity and the length of the catheter tip, which in this case is 1 inch. And I will discard that into the sharps container. Now that the bleeding has completely stopped, I will apply a sterile folded gauze over the extension site, and I will secure that with tape. I will make sure that I have discarded all of my used supplies. I will remove my gloves and perform hand hygiene. Mrs. Jackson, is there anything else that I can do for you at this time? All right, thank you so much. So I leave the call light next to you. Please do not hesitate to call me if you need me. I will exit the room, I will perform hand hygiene, and go document my procedure.